Hi, I'm Nancy. I'm one of the care queens at Urinate Care with Brenda, and today we're going to talk just a little bit about bladder, the need to pee or urinate. We all need to do it. It's one of the first things we learn as children is how to not wet our pants. One of the very first things. And as you can imagine, as a patient is in hospice or they have some other illness and they cannot urinate on their own, it creates quite a bit of anxiety. So this is fairly straightforward. Everybody needs to urinate. They need to do it on a regular basis, and our goal that we have put in our care plan booklet, we have a full page on what to do about urinary issues, and then you also can write individual instructions right here. Our goal is that everyone is able to urinate normally and naturally, and that we will help prevent any problems that arise if there are any issues with the ability to urinate. So what do we need to know? Well, incontinence can be very distressing emotionally. And so you can put your brief on your patient and oftentimes it will remain dry because they are just going to hold on to the urine as long as they can because of that emotional not wanting to wet one's pants, so to speak. Know that as a patient is going through their natural dehydration stage towards the end of their life, they're drinking less, their urine is going to look different. It's going to get darker. Just think about a day when you haven't had time to really drink very much. At the end of the day, your urine's really dark yellow and you don't have very much of it. So that's what we're going to expect. And know that if you notice that in your patient, it's not unusual. Ask, and that's a really good reason to ask, has anybody offered you a drink today? You know, if you're in the bed, you need to have a glass of water or something next to you, next to your patient, so that they always have the ability to get some fluids on board. So, dark urine, check their intake. Are they actually getting offered, and how much are they actually drinking? So what are we going to do for a patient who is now needing more care? They can't get to the bathroom by themselves. Oh, one thing just to say is that because it is such it's an innate activity that we all do, your patient who has dementia or is forgetful, they're not going to be remembering how to push that button to get help. Their brain will just say, I need to pee, and they're going to get out of bed, and then you're looking at safety issues with falls. So it's really important. What can you do? Number one, make sure that you are offering toileting regularly. Help the patient to the toilet or the commode. If you need to put one right next to the bedside, do that. But you should have your patient getting an opportunity to urinate at the toilet or the commode, unless they're bedbound, at least 3 times a day, if not more. Again, if you get them to the toilet more frequently, they'll have less accidents, they'll be less anxious, and you will have fewer messes to clean up. So gather all the supplies. If you're going to have to take care of somebody either in the bed or onto the toilet, you want to make sure that you have all the supplies you need. Gloves for your own hands, wipes in case they're disposable wipes, or if you don't have those, just a nice clean warm washcloth and some soap. Make sure if they're going to need to change their pants that you have new underpants or that absorbent brief at the bedside or at the toilet side, so you don't have to be digging around for that in the last moment. Okay, what if you find a patient who is really agitated, they're restless? One of the very first things to check on is, when did they last pee? Just think about yourself. When were you out and about and you really had to urinate and there was no bathroom around? It's so uncomfortable and you can't sit still. So if you've got a patient that's agitated, trying to get out of bed, I gotta go somewhere, first thing to do is find out when was the last time they urinated. Now remember, some of your patients may be able to urinate just a little bit. They're having overflow. They're actually having a bladder that is full. It's retaining urine, but they're just peeing a little. It's really hard to tell in a brief how much have they urinated. So if you've got a patient who is agitated, again, think about retention. You might have to try a Foley catheter to see if there is retention. If there isn't any, you don't need to leave it in. But if you find that that patient has had retention, you're going to leave that Foley catheter in. It's going to make that patient much more comfortable, and if you have a patient with, of course, a very bad wound that on the buttocks somewhere, you want to keep it wet, dry, a catheter is a great tool for helping with your care of the skin. So what are you going to do to put we're not going to go into how to put a catheter in. If you're a nurse, you know how to do that. If you're a patient or a family member, you're going to get your nurse to do that. But you might be left with having to take care of that catheter once it's in. Number one rule, within 24 hours of having a catheter, you will have germs traveling up into the bladder. So the best choice is to just keep it as clean as possible. So that means you need to have good peri-care, catheter care every single day. You can do that with wipes. You can do it with good old soap and water, but that catheter needs to be washed all the way up to the meatus, right where it goes into the body. And remember, if they've had a stool and some of the stool, the bowel movement has gotten onto the catheter, you must clean that really well, or those germs are going to travel into the bladder, and you're going to worry about a urinary tract infection. Make sure that you start at the cleanest part of that catheter, start at the top, and clean away from the patient. Okay, there isn't much else to do with a catheter besides doing the peri-care, making sure it's gravity drainage. Always keep it below the bag, below the level of the catheter, or the bladder if you can. And also get that tubing kind of coiled so it's not going below the catheter. The other thing that you want to make sure is that you have anchored the catheter to the patient's upper thigh. Anytime a catheter is pulled on, it can cause internal trauma to the bladder, and then you see blood and everybody freaks out. What do we do? It's bloody. Well, it's probably that the patient was getting up on their own, or they were being moved. It was not properly anchored, and it pulled on the inside of the bladder. And there really isn't much to do about it. Have that patient drink a bunch more fluids. If you can get them to increase their fluid intake, that's great. Let's avoid that though by doing a good anchor. Now remember, if you're using one of the newfangled stat locks, they call them, they have a swivel. They need to be clamped into the absolute puzzle piece of the two channels. You do not put the catheter through the anchor, or it just slides in and out, doesn't do its job. Also, the very first thing to check if there's no urine in the bag, is it twisted? Has it twisted back on itself? Is it kinked? That's the absolute first thing to check. There can be leaking around a catheter if a patient is having bladder spasms. So if that happens, what do? Call your hospice nurse, but put a brief on the patient. It's not an emergency if their patient is comfortable and there is urine in the bag. That can wait until tomorrow. Empty the bag. If you're on hospice, we don't really care too much about the amounts. If you have a patient that is following their intake, you might want to take note of that. Your nurse will tell you. But do inspect that tubing. Expect that there might be sediment in that urine, because just as your skin sloughs off on the outside of your body, your bladder also sloughs skin cells, and that can cause sediment that forms as the catheter is moving around inside the bladder, and it will be sloughed off. As long as the urine is flowing, again, there isn't too much to worry about. Again, if there's no urine, what do? Check to make sure there's no kinks. If there's still no urine and your patient is getting agitated, that's when you call hospice, because we may need to flush that catheter and put a new one in. Hope that helps and that everybody gets to pee on time, just the way they need to. Thanks. Don't forget to go to our website, by the way, thecareplan.net. There's lots more information about other symptoms that need to be handled.